Ask him now that you've tested the passive ranges. I just want to see you point the toes towards me. So go ahead, point. Right. He does a really good job with it. It's not so bad at all. And I want you to pull the toes back up towards the shin. Right. So what do we see here? He's flaring. Right. So it's like okay. And you say, okay, well, I want to see you do is maybe do that with a little less effort. Go ahead, pull the toes up. A little better, but you see how there's like shaking. A lot of these drills, go ahead, relax. A lot of these drills are low-level activity. It's just to stimulate your nervous system. It's not to get them stronger. So a lot of the times where, as therapists, since you're not allowed to train people, where you can get around this is you say, hey, I want you to do this drill for 1 minute. And you in your head count your repetitions. Because you have to be careful with prescribing things like sets and reps, because that's out of your scope of practice. But you're like, hey, I want you to do this drill where you pull your toes up towards your shin for 30 seconds. So you'll go ahead and pull your toes up. So pull up towards the shin, and then you're just going to relax. And when you relax it, slowly control that movement. I don't want you to just drop it. So slowly relax for 1, 2, 3, 4, and pull back up. 1, 2, 3, 4, and let it come down. 1, 2. And you just give him that. I want you to do it for 30 seconds.
It's hard.
It is hard because he's controlling what's known as the concentric range, the shortening of the muscle, and then what's more difficult is that eccentric range, that deceleration of the joint.
What's interesting is when I dorsiflex slowly, I want to use my quadriceps.
So that's other good feedback. Obviously, you can see, you can put your hand on, and this is what we're talking about. You'll see it more when we do glute, but you can feel like his vastus lateralis here on the outside wants to fire like crazy. It's like quivering a little bit. So it just lets you know, like, all right, well, obviously, the goal would be that he can just create movement down here and it doesn't go upstream. Make sense? So, and relax. I want to see you just invert the foot for me. And the whole entire time, I watch. So it's like, when he does, like, adductors kick on. So relax. See the whole entire leg, right? And pull up, nice and slow. And now that see how his foot's shaking now, because he's like, okay, I don't want this, right?
It's so hard.
And relax. So it gives you an idea. Relax. And when you guys do assessment stuff, like we talk about, hey, the adductors might be tight. So there's a very good possibility when David's foot needs to invert, he likes to recruit and use his adductors a lot. How do we get him out of that? We teach him how to use his inverters, just slowly. And laying on your back is a perfect way to do it, because his nervous system is out of gravity in some respects. Instead of being like vertically loaded, he's now just horizontally loaded. It's going to allow his nervous system a greater ability to engage and do that without recruiting the adductors. And you saw. Yeah, question?
Well, I mean, so he's laying down, and of course he can activate all these muscles up here, but if his leg was, say, like mine, he can't. So if he did the homework in this position, so they're disassociated? Okay.
Yeah, there's tons of ways that you can do it. I'm not saying they have to do it this way or that way. Be creative with it. And that's one thing that we're definitely going to talk about and why we want to be careful with giving you guys protocols. Think of this thing as like a construct to follow, but just like you're saying, already improvise it, already change it, like whatever works for that person. So for example, that would be a perfect drill for your desk worker. When you're sitting in your chair, just invert your foot without feeling your adductors and quads turn on. Find ways that you can incorporate it. Because one thing that's huge, whether it's with our work, like, hey, do these stretches, or it's someone like a physical therapist, there's this thing called boundaries to adherence. Why aren't they doing the stretch you gave them? Well, maybe it's because they have to get up out of their chair and put their elbow in the doorway. Find a stretch that they can do, like at the thing, like, hey, set an alarm on your keyboard, and once the thing goes off on your desktop, you have that 15-minute break. For your pec stretch, you're going to bring your arms out like that, and they can stay in their chair. You're going to hold it for 30 seconds. You're going to go back and do your work. Right? Same thing. You're sitting in your chair. Invert your foot. Right? Last one's eversion. So you're going to go ahead and turn the toes out. And the whole entire time, I watch, right? And turn out. He does really well with it. Way better than inversion. And one thing that you've probably heard with being in school with David is that he has really tight adductors. Now it makes a lot of sense, because he did that a lot better. What you'll see a lot of times when people evert is you'll see the whole entire leg turn out, and they'll use external rotators to evert their foot. He didn't do that. But very rarely is David like, man, my IT bands are so tight. He was like, man, my adductors are so tight. And go ahead, slowly sit up for me. The proof is in the pudding, right? Go ahead and do like a little butterfly sit. This guy. Right? That's it. Look how tight they are. I mean, yeah, and some of that's internal rotators and hips and everything, but adductors are definitely a contributing factor to that. So it just gives you an idea. That's how simple the active stuff is, and we'll do it all the way up.